Today, a team from the government's turned up to talk to Lancashire's health leaders and MPs about a bright new future.
It's a very exciting day. We've been planning for this for many, many years. There's absolutely no doubt we need a new hospital for Preston.
Nowhere more so than the emergency department. Since it was built, the hospital's become the area's major trauma centre, but the current space is bursting at the seams.
It's very tight, and parts of our department are actually taken from other departments, and we've developed them rather than being built for purpose. If you're coordinating the shift, you're constantly juggling patients from one area to another, trying to keep them safe. Trying to get trolleys past each other, wheelchairs past trolleys is always difficult.
And how does that impact on patient care as well?
Overall, it just slows it down. You're constantly trying to find a place for your patients to go and for doctors and nurses to actually do their admin work as well.
Would you like a drink?
That lack of space is everywhere. In the stroke unit, 40-year-old Wendy's getting rehabilitation from a team of therapists. But they've all got to squeeze into a curtained-off space on a 6-bed ward.
Rooms that the therapists and others used to use have had to be taken up with more beds because we need to meet that demand, obviously. But it's meant that all the interventions and rehabilitation that they deliver here are done in that bed space, and that is limiting. And also, you know, we do work really hard to protect privacy and dignity, but it only goes so far when it is curtains and not walls.
Those designing the new hospital, like Claire, want it to have more single rooms. They also want it to be easier to get around so patients and staff aren't wasting time going between treatments.
If we had a hub of diagnostic facilities and along with it a spoke model of the clinical services that we require, then the travelling time will be far less. People will be able to walk over just to organise things. At the moment, that's a big impediment.
As with the Royal Lancaster, no decision's yet been made on where this new hospital's going to be. But the one thing that we have been told is that it'll be to the south of Preston. And that brings it nearer to Chorley, which has its own hospital with an A&E which has been threatened with closure on several occasions. So what does that mean for there?
We are absolutely committed to delivering and providing our A&E services from the Chorley site until the new hospital opens. So that's at least for the next 10 years.
What about after?
So after, that will depend where the new hospital is, and the one commitment I can give absolutely, that will be full engagement and full consultation, because it's important that we get this right. We'll have one shot at it, and it's important that we get it right for the future.
Jill Dummigan, BBC North West Tonight at the Royal Preston.